Tennis elbow, shoulder impingement, Achilles tendinopathy, patella tendinopathy, greater trochanteric pain syndrome, which is essentially sore side of hip. I'm naming the main tendinopathies. So these are similar conditions, not all exactly the same, but where the tendon, which is where a muscle attaches to the bone, becomes irritated. Incredibly common sports injuries as well as in the general population. And they all have some common themes, so we won't pass out exactly the details of each of those. I'm sure we will in future videos. But just to give you a general idea as to how to best manage tendinopathies. For prevention, it's very difficult for us to pass out a specific variable, but generally speaking, we understand that tendons respond really quite slowly to changes in workload or changes in their environment generally. So that's where, if possible, although you can't control everything, you want to make sure you scale up your volume, whether that be with running, whether it be gym training. Even when it comes to things like if you notice that you're particularly run down and worn out, then trying to run that off isn't probably the greatest idea if you've not been training so much recently. So all these changes in what's called your homeostasis, your general baseline level of ability and fitness, you want to try and make sure that you're making adjustments either up or down from that fairly slowly, because the tendon responds quite slowly to it. So it can then flare up, you can notice swelling in the area, or you notice that it's really quite sore and tender. Now these are very treatable, but also there's an awful lot around there that would sell you the world. Because they're common, it means that some of the lies and salesmanship can be common too. So always sort of smell a rat and raise your eyebrows if anyone's selling a magic cure for tendinopathy. We recognise that all of the conditions I've just mentioned there before, they take a bit of a wider, more complex strategy. We can sometimes simplify the exercises for them, but generally the cause of those things is usually more than just it needs a specific type of robe or ointment or lotion, or certainly it shouldn't have any injections anywhere near it from what we now know from the science. So bear in mind that it should be something a bit more wide-reaching than just the particulars, and especially when it comes to someone that might want to torture you with some sort of wacky device or foam roller and things like that. Again, raise your eyebrows and give us a shout.